Good afternoon. I'm Terry Scoggin, the CEO of Titus Regional Medical Center in Mount Pleasant, Texas. Today's Thursday, March 3rd, 2022. Time for our COVID update, community update, spring update, as we start talking about the sun's outside and it's gorgeous. So I hate to be in here or even be in the office this morning in meetings, but it's a gorgeous day outside and spring is definitely coming around the corner. We're excited about that. Wanted to take a few minutes as we start March. We're going to continue our COVID updates in March, so we'll do it every week, every other week. Whatever we need to just to get information out there. But just want to things going around the hospital or health system this week and just give everybody a heads up. Want to start off and wish the Mount Pleasant Tiger basketball team good luck tomorrow. They'll go to regionals, I believe. Please don't correct me or get on to me, but it's going to be the 5th straight year going to regionals in the finals. So it'll be regionals this weekend, so good luck to them. They're fun to watch. If you cannot make it to Frisco or to Garland, watch them play Frisco, go online, watch them on Facebook. There's plenty of coverage now, some great coverage online, streaming that you can watch the team. But Coach Chisholm, Coach Barkley have done a great job with the team, and they've had some exciting wins this week. Fun to watch. So if you don't have plans tomorrow night and this weekend, go support the Mount Pleasant Tigers. Good luck to them this weekend. Had a chance a couple hours ago to go over to the high school and meet the new football coach, Coach Cooley. Had a great meeting with him, talking about how we can help him and his team as far as from a health system standpoint, our physicians doing physicals, but also some training and some other things. So we're excited to welcome him and his wife to town. It was fun to hear about his 2 daughters and his wife. She's also a graduate of Texas A&M, so I mean she's a great lady. But we're welcoming them to town and glad they're here. Want to also welcome another great lady, Dr. Jane Lee. I think I've mentioned a couple times, but Dr. Lee joined us January 1st. She actually started working a few days earlier because she was in town. Her family was able to get settled and she was ready to work. So she took call even before the year started here at Titus Regional. But Dr. Lee joins us from Maine via California with her and her family, and she's a general surgeon here at Titus Regional Medical Center. She's part of Surgery Associates of Titus with Dr. Beauvais over the Medical Plaza on the west side of our campus. Dr. Lee's phenomenal. Great general surgeon. She brings a great wealth of experience to this community. The nurses and the OR team have been just very excited talking about the work that she's doing, the things that they're learning from her and working with her. We're just excited to have her and her family here. So if you see Dr. Lee or you need any general surgery, contact her office. We're in the process of getting all the insurance. So it takes sometimes for anywhere from 30 days to a year to get her on all the insurances. But please go ahead and give her a call. Get in to see her if you need her. But we're excited that her and her family's here. We are excited to announce that Dr. Kincaid from Colorado will be joining us later this summer. She is another general surgeon. We'll be finishing her residency in May and June, and will be joining us. So we're excited to continue to add great physicians to the Northeast Texas area. I want to give an update of COVID. COVID's still there, regardless of what you see, what you hear, and what you read. We've seen for over the last year, we have to learn to live with it. And now that's what everybody else is saying, so they're catching up to the smart brains in Northeast Texas. But from a COVID perspective, we're handling about 2 patients in the hospital at a time. 1 to 2 in the ICU, 1 to 2 on the floor. So we're hovering this last week between 2 and 3 patients. Now, I don't want to be Debbie Downer or Negative Nancy, but I do want to make sure you understand we still are diagnosing people very, very sick. We don't have a ton of patients, but we still have patients that are intubated. We've still lost some precious people over the last few weeks who've died of this horrible disease. So I know it's going down and it's not the lead across the nation, but I do want everybody to understand in certain people with certain comorbidities, it is deadly, it is lethal. So we have to continue to stay very active in what we do as far as hand washing, masking, social distancing, vaccinations. All those things will help mitigate the risk of it getting severe. We're continuing to spread. We're moving to the endemic stage. It's still part of our lives now, but COVID is still there. I just want to encourage you, encourage your family. If you haven't been vaccinated, I would encourage you to be vaccinated. The vaccination rates still in Northeast Texas are way below the state of Texas and the United States. We offer them at the Family Care Center at Harts Bluff, just northeast of our campus on the other side of Interstate 30. Renee and the team over there at Harts Bluff do a great job of vaccinations and also boosters. We offer the booster over there. You can go online to make an appointment. You also can give them a call at the Harts Bluff Family Care Center to get an appointment as well, or just walk in and then we'll get you taken care of. But I would encourage you, if you've not been vaccinated, please get vaccinated. It's never too late. And if you haven't had your booster shot, please consider getting your booster shot. Just another thing that you can do to continue to reduce the risk of a critical case of COVID. We're excited about this. We did a thing a couple weeks ago. We did virtual lunch and learn. It was actually pretty good. I've got some good comments from people. Some people really love the lunch, and we're able to start talking online. But everybody's ready to get back together, and our plan is to get back together. And with the spring months coming and the sun in the air, Wednesday, March 9th, we will do lunch and learn at the Civic Center. We start at 12 o'clock. The program, get there around 11:30. That's when the social event will happen. People talking, seeing each other. The first time in 22 months, many people have seen each other. So it'll be an exciting day. We're excited to do it. So next Wednesday, March 9th, Lunch and Learn live at the Civic Center. Now we have raised the price. It is $5. It's been 2 years since we've done it. So we had to go up from $4 to $5. We had $4 for many years. I'm just warning everybody who's goes, please don't yell at the lady taking the cash. It's on me. So when I walk in, pull me aside and we can talk about the increase to $5. But it is $5. You get a lunch much worth $5. It's a great lunch and you get to see your friends and family members here. So we're excited to see everybody next Wednesday, March 9th at the Civic Center. Another thing that's going on this weekend, and wanted to finish today with this one, is our React Quicker, Save Your Ticker Heart Health Fair. February is Heart Health Month, and we want to continue and make March Heart Health Month as well. With so many things going on, COVID still in January, the start of February, we were slow to go ahead and didn't really want to pull the trigger on doing the health fair in February. It is a big event for us. It'll be in the lobby Saturday morning, so it starts at 8 o'clock and goes from 8 to 11. We encourage you to come early. That's when all the good stuff gets handed out and everybody's having a good time. I want to commend the team across the board for the events that they have planned. We're going to do some new setups, so lab won't be where it always is. So get ready when you come in. Change is good. So as you show up at the health fair, we've got lab a little further down, so it won't be a bottleneck coming in. The rain's going to be later in the day, so we should have a good morning to come in. But come see what's going on. A lot of our departments are showing some things, showing the evidence-based practices that they're doing on a daily basis. So there's some things that are going on at the health system with neurology, with heart attacks, and the primary heart attack center. All across the hospital, these things are going on, and we're going to showcase them. We've got some things going on in the ambulance bay with our new ambulances coming in and some of the systems. They'll have a new toy there and be practicing hands-on CPR and have some contest of how many compressions and some good music coming that you can do the compressions too. But we got a lot of things going on. I'm excited about it Saturday morning. I'll be there at the front door greeting people. But get up early Saturday morning, get dressed, put on your smile, put on your mask. Don't forget your mask, and we'll have a few I'll be handing out if you need one. But put on your mask and come join us on Saturday morning, March 5th, 8 o'clock at the TRMC Mall lobby. Just come on in and have a good time. We'll look forward to see everybody, but it's our opportunity to try and improve the health, create healthier tomorrows here in Mount Pleasant, Titus County, and Northeast Texas. Again, I want to thank you for joining us today. I want to thank you for coming and following us. Please share this. Please like this. Please tell your friends about the React Quicker, Save Your Ticker Heart Health Fair. We're excited about that. Thank you again for your support. God bless.